I'll ask if there are any adjustments to the agenda from anybody. Yes, Commissioner Traeger.
I would like to pull approval of the last meeting's minutes off the consent calendar, just so I will likely abstain as I wasn't present and in office at that time.
Okay, that's item A1, 7A1, and we can vote on that separately.
Thank you.
Okay, any other adjustments to the agenda? All right, not seeing any, we'll move to Commissioner's business. And as I can read here, it's a presentation to the board chair from Vice Chair Bernie.
How's that? The first item of business is you saying that we're going to give you an award. Heather, excuse me, Chair Buck, it is my honor on behalf of the entire Board of Commissioners, and not just on behalf of the people of your district whom you serve, but all of the people in Lane County who you served as board chair, to thank you for your year of service as our board chair. You were steadfast. You really were. You were a rock. And best of all, because as vice chair, I had to call you so often for directions and guidance, I became Adelaide's honorary Uncle Joe. So best of all, as vice chair, I get to be the person to give this to you. I'm going to attempt to show it. We've never done it this way before. Can you see that okay?
I can.
And what this says is, it's very heavy. I'm shaking. It's got to weigh at least 40 pounds. And it says, presented to Heather Buck. In gratitude for your service as board chair, Lane County Commissioners 2020. So on behalf of all of us, thank you very much, Chair Buck.
Oh, thank you. I appreciate that. And I appreciated being chair for 2020. There was a lot going on that year, and but I felt like we did a lot of good work collectively. So we will move to item 2B, election of a new chair. Are there any nominations from the floor? Commissioner Farr.
Chair Buck, I nominate Commissioner Bernie to be the chair of the Board of County Commissioners for 2021.
I'll second.
Very good. Got a motion for Commissioner Bernie to be chair for 2021 from Commissioner Farr and second by Commissioner Traeger. Any discussion? I don't see any, so we'll call for the vote. All those in favor, please say aye.
Aye.
Aye. All right, Commissioner Bernie, you are now Chair Bernie, and I turn over the proverbial gavel, because I don't actually have one here at home, to you to run the remainder of the meeting. Congratulations.
Well, thank you very much. If I may just say this very quickly, this is an honor that on a personal level to come from 4 people, as well as commissioners, that you're bestowing on me. It means a lot, and yet it comes with mixed emotions. This is going to be a tough year. This is going to be a long year. And my fondest hope for all of you that were kind enough to vote is that all of us pull together as a team, and I know we will, regardless of political stripes, facing this year's uncertainties. So thank you. I'm semi-unprepared. I'm going to need your help. Please don't ever hesitate to help. Does that mean I have to run the meeting right now?
Yes, it does.
That's what I was afraid of. Okay, election of vice chair. Do I hear any nominations? Commissioner Buck.
I would like to nominate Commissioner Traeger for vice chair. It was a wonderful opportunity for me when I first came on the board to be vice chair. It gave me a chance to get to know all the staff, get to know the inner workings of the county. And I think that would be a great opportunity for our newest member.
Are there other nominations? Commissioner Bozovich?
Thank you, Chair Bernie.
Don't laugh when you say that.
I was laughing because I remembered to say chair instead of vice chair. Sorry, I'd like to nominate Commissioner Farr to be vice chair due to his long experience, and I think he can be very helpful to Chair Bernie through his year as chair.
Are there any other nominations? Would either candidate like to make a statement before I call the vote?
Mr. Chair, I think you need two motions, and then you would need a second on one of those motions.
Well, I'm going to presume Commissioner Buck made the motion to nominate Commissioner Trieger. Oh, and I need to vote. We need to vote on each one of those motions.
I'm saying I believe you need a second on one of the motions to vote on that motion.
Is there a second for Commissioner Trieger?
I'd be happy to second that motion for my nomination to vice chair. Thank you.
Okay. And we also have a motion on the floor for Commissioner Farr to be vice chair. Is there a second to that motion?
Commissioner Bernie, we should vote on the first motion first.
That's exactly the kind of help I've been asking for. Thank you very much, Commissioner. Okay. All those in favor of the first motion for Commissioner?
Discussion to the motion?
Yes, discussion of the motion. I apologize. Thank you. I'll get there. Thank you, Commissioner. Is there any discussion on the motion for Commissioner Trieger to be vice chair? Hearing none? Commissioner Bozovich?
I'm perplexed because I've never seen an election for an office run as two separate motions. Usually I see nominations, seconds of nominations, and then a competitive vote between, if there's more than one nomination between the candidates. So I'm confused as to how we're running this election. I was trying to real quick grab my Robert's rules just to look at that. It would probably,
I have no problem
probably take me 10 minutes to look that up, but it just procedurally, this is the first time I've ever seen an election run like this for any office.
If I can interrupt for one moment, I believe we have Steve Dingle on, who is the parliamentarian, and he could weigh in.
Good morning. I've been listening, so I believe what's happened is that we've had a motion made and seconded for Commissioner Trieger to be vice chair, and there's been a motion to nominate Commissioner Farr for the position of vice chair. Is that correct? But there's not been a second?
There has been a second. Oh,
has there been a second for Commissioner Farr?
Yeah.
Okay. All right. I don't have Robert, my copy is at home, but my quick recollection is that I believe Commissioner Bozovich is right. If there's more than one person, then you just have a vote.
Well, then I am going to, in my first controversial move as chair, choose to have the vote that way unless someone can tell me that that's inconsistent with Robert's rules. Okay. Hearing no objection. Steve? Mokraheisky, any objection to that? Okay. Commissioner Farr?
Thank you. As a discussion to the motion is to for Commissioner Trieger to serve as the vice chair for 2021. And what I would like to say about that is something that I said a year ago regarding the protocol of selection of officers and the rotation of selection of officers. Most elected bodies choose to move through the members of the body in a particular kind of order in order to maintain not just a continuity of the leadership, but also to maintain a diversity in the leadership. And Chair Bernie, I'm going to say something that's very direct, that's kind of the elephant in the room. There are people in this community, many of them, who think there's a division on this Board of County Commissioners. This election would illustrate such a division. And this motion illustrates such a division. I don't believe that division exists or needs to exist. I believe that a diversity in the leadership in this Board of County Commissioners, based upon what may be the common perception in the community, a perception that is driven quite frequently by statements, sometimes by elected officials, sometimes by newspapers, sometimes by quasi-newspapers, that perpetuate a rift in a Board of County Commissioners. There is no such rift. Commissioner Sorensen pointed it out yesterday that we had that most of our votes are unanimous, and when there's a discussion, there's a lively discussion that represents two sides of an argument. I believe that the vote in favor of this motion will continue to demonstrate what people perceive as a rift in this Board of County Commissioners. I wish to end that.
Thank you very much, Commissioner Farr. Commissioner Buck.
When I came on board with Commissioner Chair Bernie now, 2 years ago, it was my first year and I was nominated as vice chair. And I mean, this is not necessarily inconsistent with the way in which we've nominated chairs and vice chairs in the past. So, I mean, this is a perfect opportunity for a new commissioner to get get new relationships growing within the county. And I think it was a wonderful experience that I think she would do wonderful at. And, we have opportunities for everybody here on the commission to be on various committees and boards, and the vice chair is somebody who just is going to be willing to support our chair and be there if the chair is not available. But I don't think that we are doing anything different, really, than we've done in the past.
Thank you. Commissioner Trieger.
I just want to speak to Commissioner Farr's comments and appreciate them. Thank you, Chair Bernie. I agree with you about the rift, and Commissioner Farr, you and I have a long history. We've done a lot of work together in the community, and from whatever seat or whatever role or title either of us might have on this board, I am committed, as I stated in my comments when taking the oath of office yesterday, to working collaboratively and to working from a place of our shared goals and our shared values. And that is independent of any particular title or position any one of us has. So for me, should I be so fortunate as to be nominated to be the vice chair, it really will, as Commissioner Buck mentioned, be a great opportunity for me to make that steep learning curve accelerate so that I can be better at my job and give me that opportunity to learn more about the county in broad brush strokes through being in that seat. And I would very much appreciate it. And I'm committing, should I be in that seat, to not furthering any real or perceived rifts, as you mentioned, Commissioner Farr.
Is there further? Thank you, Commissioner. And it's a pleasure to call you Commissioner Trieger. Is there any other comments? Seeing and hearing none, I am simply going to comment that I believe that both Commissioner Farr and Commissioner Trieger would be incredible vice chairs. Both would surpass me so much it's not even funny. I heard both commissioners say in their own words yesterday in their swearing in that this year we must and will work as a team and be perceived as a team to deal with issues as they face us head on. This is going to be a very challenging year. I don't think this is a high stakes vote, and I'm prepared to call for the vote unless there are additional comments. Hearing that, all those in favor of Commissioner Trieger for vice chair, please signify by saying aye.
Aye.
All those, I heard 2 ayes. All those in favor of Commissioner Farr for vice chair, please signify by saying aye.
Aye.
Aye. And Commissioner Farr will be the vice chair by a vote of 3-2. Moving on. And I think it's anyway, I think that this board, it's going to be critical that we work as a team, and we would be working as a team whomever had that slot. If I don't mess up. Okay. We are now at, and forgive me as I'm doing this, we are now at item 3, emergency business. Is there any emergency business?
No, there's not.
Here, thank you, Steve. Public comments. Please bear with me. With this virtual format, some housekeeping items. To the public watching, you are currently registered in this meeting system as attendees. Attendees are webinar participants who are audience members viewing the meeting. Your microphone and webcam are automatically muted as attendees. There will be a time, and this is the time, when that is open for public comment. At that time, if you wish to participate in public comment, I will ask you to raise your virtual hand to be recognized. You should see a hand icon on the device you are using to watch the meeting. Press the hand icon once to raise your hand. When public comment begins, our meeting organizer will call names. When your name is called, you will be unmuted and given 3 minutes to make your public comment. When your 3 minutes are up, you will return to muted status and the next name will be called. You can then continue to watch the webinar as long as you choose. The intent here is that everyone wishing to make public comments has that opportunity because your comments are critical. But please note, if there are more people wishing to speak than time allows, we may need to either limit the number of speakers and/or reduce the time allotted per speakers. Speakers will then be selected randomly to participate in public comment. And at this point, it's my understanding I hand it to the moderator. Is that correct?
Correct.
Okay, moderator, do your thing.
Thank you, Chair Bernie. I do not have any attendees signed up for public comment, so I will turn the meeting back over to you, Chair Bernie.
No rest for the weary. Okay. In that there were no public comments, do any commissioners choose to use our response time to make a comment of their own at this time? Hearing and seeing none. County administration, COVID-19, item 6A, COVID-19 response and recovery, Mr. Mokrahysky and Mr. Adams.
Thank you, Chair Bernie and commissioners. I'll just make a few brief introductory comments, and then we have Steve Adams with us today. Steve is our new incident commander. He started, I think he's on week 4 here in Lane County. We're really pleased to have him leading our COVID-19 emergency response efforts. I wanted to, Steve will share with you some details, particularly, we'll do the traditional update on our COVID-19 emergency response, but we're going to focus particularly on vaccination process locally here in Lane County. And I wanted to just tee up that conversation. There's been, I think, some healthy, I shouldn't say healthy, some miscommunication and misunderstanding, certainly at a national level about vaccinations. We've heard, and I've heard from some local businesses and residents who've said, well, I watch the national news and I see lines in other states for people that are able to go and for seniors, for example, that are able to go and wait in line to get a vaccination. And that's not happening here in Oregon. Why is it different? And so I think it's really important that we start just by acknowledging that the role of that the federal government has played in the vaccine process has been largely to distribute the vaccines to states, and they've largely left with some federal guidance that's been provided by the CDC's Advisory Committee on Immunization Practices. They've largely left the prioritization of vaccinations to state governments. And so in Oregon, so that's why you see different states handling the prioritization of who's getting vaccinated in different ways. Here in Oregon, the Oregon Health Authority has taken the lead in determining the priority groups. You heard that previously, 3 weeks ago, we provided an update to the board, talked about the first 2 phases of the vaccination process. And in phase 1, you have 3 groups, 1A, 1B, and 1C. 1A are and that's where we're at right now is the 1A group. 1A is hospitals and other healthcare workers, long-term care facilities, and emergency medical services. So that is the group that is currently, you'll see healthcare workers at Peace Health. You'll see healthcare workers in Lane County at McKenzie-Willamette, and a number of others that are receiving their vaccinations. The next group will be 1B, which is essential workers, and the state OHA is meeting within the next few weeks to determine and to define really what essential workers means. Essential workers is a large category, and a lot of people could claim that they are an essential worker, and we are waiting on guidance from the state on who they advise should fall in that essential worker category. After essential workers, and these likely will be frontline workers, people that have direct public contact with large numbers of people. But specifically what that means is yet to be determined by the state. And then the third priority group within phase 1, group 1C, are adults with high-risk medical conditions and adults 65 and older. So those are the first 3 groups in phase 1. Again, we're in the 1A category, focused on healthcare workers. Then when we get through that group, phase 2 will be the general public. So that's how it's being handled in Oregon, and we're following the state guidance and regulations around those prioritizations. You may also recall that there was a phase 3 group which we talked about, which was essentially the same as phase 2, and that all the remaining phase 1 plus the general public would be included in that phase 3 group. Since that time that we provided that initial update to you a few weeks ago, the Oregon Health Authority has focused on providing much more detailed guidance on those phase 1 categories, even more so than what I just noted there. It's been broken down into 4 specific groups, and Steve Adams will cover that in greater detail. We also understand that there's a 5th, the state has created a 5th group within phase 1 in support of the effort to reopen schools. So that's generally, I just wanted to sort of, and I want to call on the commissioners as our elected representatives of the public in Lane County that, there remains some confusion about this because, again, you turn on the national news and you see one story and different sort of examples of what's happening in different places. And then you look here locally and it looks different than what may be happening in other places. So it's really important for the public to know that we're following the state guidance, recommendations, and rules on vaccination process. And so with that, and then I will just say that we are making an effort here in this week and in the next several weeks to really enhance our messaging, communications, and outreach around the vaccination process and share with folks what we know and what we don't know, because there's a lot that we don't know that is still to come. But we really want to make sure the public understands at least what we do know. And we'd ask the board that that each of you share that information, and that for those watching, that you share the information and access to the different links and things that we have available out there for folks. So with that high-level overview, I'll turn it over to Steve Adams, our incident commander for a COVID-19 emergency response. Steve?
Thank you, Steve. Chair Bernie and commissioners, I wish you all a Happy New Year. I'm going to pull up my presentation here. Okay. Let's see, my apologies for the technical difficulties here. Aha. Okay. Are you seeing my slides, commissioners?
Yes, we are.
Okay, wonderful. Okay. So thank you. Very quickly, and I will follow the format that Steve just outlined. I want to share with you some of the graphics that you have seen. So this is the epi curve that we've been tracking since the beginning of the pandemic. You will see specifically as of yesterday morning, 7,229 cumulative cases in Lane County. You see the real effect of kind of the Thanksgiving, post-Thanksgiving surge that we've seen here in the fall. And we have noted a bit of a leveling off here as we go through the holidays. I think that as of this morning, there's 61 additional new cases that are not captured on this graphic, and an additional new death that is brings us to a cumulative total of 95 deaths within Wayne County. I think that it's important to note that while these trends are positive as we look at them, to some extent there is also a bit of a holiday artifact here as well. We saw testing levels, those presenting themselves for tests decline during the holiday period. And we also saw kind of reduced capacity within some of the labs. We've noted kind of increased delay times as some of the lab staff obviously took time off during the holidays as well. We anticipate going forward that we will begin to see a little bit of an increase. And I think it's still a bit early to see any new kind of surge that might be happening as a result of holiday gatherings that may have occurred within Lane County, or those returning from other places around the country or the state who likewise may have maybe triggering additional surge. So we anticipate, though, at this point, we have seen some reduced kind of daily numbers. And as you know, the net positive really drives the workflow here within the EOC, and much of the case investigation and the contact tracing and the case management. We have noted over the last couple of weeks, we've been much more steady, but we've been able to hit all of our performance marks in terms of 24-hour contact tracing and follow-up and addressing all of the case management concerns. This next slide is likewise familiar to you. This is the new county risk matrix that was instituted at the beginning of December. After the freeze of 2 weeks, we then emerged into a case in which the state does a 2-week process. There's a warning week and then a movement week. We're currently in a warning week now, so our data will not change. Our status will not change, but we remain within this high risk category in which our case counts per 100,000 are above 200, as well as a test positivity rate over the past 14 days of greater than 10%. And so those are the criteria for large counties, of which we're one. And this morning, the state released this latest kind of data. So you'll notice that we're actually trending downward here. We're hitting the test positivity rate. We're still below the 10% range that we would need to do or to trend down. but our cases per 100,000 remain above that 200 mark. So you'll see too in these 2-week trending averages that we're headed down at this point, but I would caution that we may see some upward movement here as we get through the kind of holiday bubble. So as we think about these risk categories and some developments certainly since the commission last met in mid-December to hear an update on COVID-19 issues. The governor did announce on December 23rd direction to the Oregon Health Authority and to the Oregon Department of Education in which the previously mandatory risk criteria for school reopenings would become advisory effective on January the 1st. She likewise advised those two agency heads to work together to make any adjustments to the risk metrics in an advisory capacity by January the 19th, and to provide that then to school districts to make their independent decisions about their time and their process for reopening. It likewise put local public health authorities in the position of advising their respective school districts. So for the 12 school districts in Wayne County who are, many of the staff are just returning from a holiday break this week, we will be meeting with them later this week to really more fully understand their plans, their thinking, and provide whatever technical assistance that we can for them. So as promised, I wanted to really kind of bring you up to speed on the vaccine efforts. So when we last briefed the board on the 15th of December, we had yet to see vaccine arrive in Wayne County, and we were hearing that the kind of very high level guidance from OHA with respect to how the vaccine sequencing would happen. And as Steve noted, there was the phase 1 with the ABC, the phase 2, and then there was indeed a phase 3, which was completely repetitive with phase 2. And it was in large measure following the guidance from CDC in terms of sequencing. And of course, the CDC guidance is purely up to each state governor to determine the extent to which each state will follow that guidance. So as vaccine began to arrive in the 3rd week of December, OHA released much more detailed guidance for phase 1A. And we have really been quite focused on fully understanding the rollout of vaccine here. So we had Pfizer, as you'll recall, and then Moderna, secondly, coming online in terms of being shipped in late December. And we have since received both vaccines here. So the federal government has been dispersing vaccine to the states, to a central repository in each state from the manufacturers. And OHA was direct shipping vaccine to hospitals, which was initially the highest priority. But also included in this group 1 are urgent care staff, skilled nursing and memory care facility, healthcare providers and residents. And that is being done by a consortium of large pharmacy corporations, including Walgreens, under a separate contract from the federal government and receiving shipments directly from the federal government outside of the state's allotments, tribal health programs, EMS providers, and other first responders. So as we have seen the rollout, we have continued to see specific reporting for that. We have yet to conclude Group 1 and will remain within Group 1 as we understand the progress thus far, likely within the next few weeks. Steve mentioned that we are hearing that Group 5 is being created within phase 1A. We have heard this only verbally from OHA staff in a number of different calls now. but we have yet to receive specific guidance. The terminology that has been used is educators. We would imagine that would include obviously teaching and instructional assistants, staffing within the schools, but presumably it would potentially include others within that process. So I'll close with the status report. So within the last couple of weeks, OHA has created a vaccine tracking dashboard showing statewide trends, but also county level trends. So this is as of midnight Sunday evening through the state's alert system. 4,342 individuals had been vaccinated within that phase 1A group 1 group in Wayne County. So again, for the hospitals, urgent care, skilled nursing, and others, EMS as well. The alert system is the typical vaccine tracking system. So if your child received MMR vaccination, or if you ever called your provider to find out how old your last tetanus shot was when you hit that rusty nail, it's the very same system. And within this system, providers have 72 hours to upload the data. So there's a bit of a lag in the data that are being reported. So as you look at the bar graph on the lower right, you see the daily administration of vaccine, and you see a little bit of the artifact of the holidays there as they were scaling up. But to give you a sense of progress, just in communication with Peace Health last evening, as of January 1st, they had completed 3,244 vaccinations of their staff. They were reporting about half of the staff within Springfield and Eugene having received a vaccination, and they reported that at Peace Harbor and Florence, they were over 50% with respect to their vaccination completion. And that, of course, is the first of 2 doses. Finally, I wanted to really kind of note some progress accomplishments with Eugene Springfield Fire under the leadership of Chief Campy, the emergency medical officer there, who received 1,000 doses last week. As I'm told, the doses were received at 1 p.m. in the afternoon, and they were administering their first shots by 3 p.m. So they've administered, as of now, over 670 doses, first vaccinations. They've had a voluntary acceptance rate amongst the folks who have been offered shots of about 90%. And they had dispatched, she was telling me yesterday afternoon, 40 doses out to the coast for Siuslaw Fire and for the Florence Police Department. Over the weekend, Chief Campy held a clinic at the fire station just off of River Road and was providing vaccination for police officers and first responders from several jurisdictions: Junction City, Coburg, Cottage Grove. And she has accounted for many of the rural fire districts, as well as Life Flight, in all of her efforts to get that going. So she has stood up a process in which she's able to administer about 125 vaccines a day. She's hoping for a second round of vaccine coming later this week, but as of this moment, that has we are still awaiting word. Finally, I want to note partnerships and work that is happening within Wayne County Public Health and with our partners. We anticipate, obviously, the vaccination process really learning from the vaccine processes that we've had. You may recall the H1N1 outbreak back in 2009, and that was kind of a trial run for the sort of vaccinations that we're doing here. And you may also recall that there was a meningitis outbreak at the University of Oregon in 2015, 2016. Somewhere around 23,000 individuals required a vaccination. And that was not unlike the COVID-19 vaccination, in which each individual had to get multiple doses. So that just kind of creates, some of the logistical challenges associated with that. So Wayne County has a standard vaccination plan and protocol, but we're making rapid adjustments to that to account for the challenges associated with COVID-19, both in terms of the scarcity of supply, the kind of challenges of understanding the information flows coming in, having greater situational awareness around who has vaccine and what inventories are available at any given time, and understanding what our role is in public health of really trying to identify and fill gaps as they come in. So the process really has been a little bit challenging, and the guidance that we're getting changes from week to week, day to day sometimes, and we're having to make adjustments. But within the first couple of groups, we're largely dealing with kind of closed pods of vaccine recipients. It's much of the vaccine is being delivered in an employer-employee relationship within a known institution, or residents, for instance, within the long-term healthcare facilities that the pharmacy chains are taking care of for us. As we get into some of the later groups, and you notice group 3 and group 4, we're really kind of the outpatient clinics, right? So your specialist, your primary care physician that you go visit, these are much more diverse and diffuse populations. And we're already beginning to work with some of the larger practices in town who have volunteered their space and their staff to help us deliver vaccine to other smaller clinics who may not have direct access. And we are making specific plans and working with the University of Oregon and Wayne Community College and other larger facilities that actually can enable us to begin to look down the road towards kind of mass vaccine drives. So not unlike, and really learning from the experience of what we were doing for mass testing, and beginning to convert some of those activities into mass vaccination processes as we get further and further down the road towards the full general population. And with that, Steve and Chair Bernie, I would be delighted to entertain any questions or clarifications.
Well, it looks like we have several commissioners that would like to delight you. First, Commissioner Buck.
Thank you, Chair. I have some questions, especially since we've seen some stories come out on the state release of vaccinations. I think the Oregonian came out and some other articles. And this is really about, how many doses the state has received and how few are actually getting into people's bodies. It sounds like it's roughly 25% of the doses that Oregon has received are actually getting to people. And I know that there's a myriad of issues in order to distribute, but it also begs the question as to why we don't have the National Guard or some other large organization like, I think there's a medical wing of another organization that could help. And so that, again, also begs another question is, of the doses that we are getting in Lane County, how many of those are actually getting in people's arms? And do we have a way in which to ensure that we are getting them out of our storage and into people so that we don't have the same 25% of 25% actually getting out to people? I'm pleased that, our fire and EMS started getting their vaccinations last week, but it just concerns me about the distribution. And do we have enough people to actually put all of those vaccines into people? There's been, a discussion about there aren't enough trained people. It could take 15 to 30 minutes in order just to get one person their first dose. Can you talk a little bit more about that? And I think that organization I was thinking of that has a medical wing is Serve OR or Serve OR. I don't know if you know about that particular association. I'm just hoping you can share, and hopefully we'll hear that we are distributing ours at a much quicker rate once they get to us.
Chair Bernie, and thank you, Commissioner Buck, for the question. So indeed, we have noted and have been following the news very closely, as well as trying to understand the vaccine shipments coming in. As I understand the process at the state level, they're essentially learning on Tuesday what their delivery will be for the week, and then turning around and making decisions and pushing it out Wednesday and Thursday. So that seems to have been the process for the last couple of weeks at the state level. I think that certainly within the larger supply chain, in terms of getting the vaccine once delivered into the arms of individuals, there are some additional steps with this vaccine because it is under an emergency use authorization. So there's some additional paperwork that has to be completed by the recipient in the process, and so that does provide some delay. There's a little bit of training that is required for providers who are just now taking on both for Pfizer and for the Moderna vaccines. It's web-based, and as I understand it, it's fairly quick. I think some of the data lags associated with the reporting system does account for some of the discrepancy between what's shipped, because that's being reported in real time, and then the doses administered, but I don't think it accounts for the full discrepancy. I think that some of the issues within the hospitals, as well as even with the EMS providers, is in terms of timing. I think out of an abundance of caution, many of the hospitals have sequenced their administration of doses in such a way that only a small portion of the staff of particular departments are getting their doses. So the concern being that if you gave the entire X-ray department, for instance, a dose, and you had adverse reactions, you could in fact have, lose the capacity of that team during this period of time. So I think there has been kind of a slower pacing in terms of what that looks like. One of the other challenges that we've had, Commissioner Buck, is that as we look into the state system, we can only see vaccine scheduling that is targeted to us. We do not have visibility into all of the vaccine distributions that are going to various recipients within Wayne County, like the hospital systems or EMS, who are receiving them separately. We've only been able to, it is a literal game of telephone to figure out who's got doses and where they are at this point. We have communicated that need to OHA, and they have indicated that this week they're working to give us greater visibility so that we can see that. Thirdly, we understand that the protocol is that once the direct shipment providers have excess doses, those are to be centralized within Wayne County Public Health for redistribution elsewhere. So as we get to points of saturation for the larger hospital chains, for instance, and they have additional doses, we then will be able to distribute that out. So I think those are some of the challenges that are associated with the logistics. The personnel issue, I think, is one that is very much on our mind in terms of thinking about some of the challenges that we want to overcome. We do 2 weekly calls with the provider community in Wayne County that Dr. Ludke leads, and we have indicated and have received positive feedback that many of our local providers are quite willing to volunteer to really kind of help us staff that up. And many of them are being incredibly altruistic in providing, their own staff on their dime to be able to administer vaccine as well. In terms of some of the volunteer organizations, the Medical Corps, I'm told that we've had diminished capacity there because many of those members are older. I'm not sure if that's the same organization that you were citing, Commissioner Buck, but one of the medical volunteer units here are composed of in a goodly share of retired former medical professionals who, by virtue of their age, are in a higher category and have been reticent to play a role, particularly in the kind of earlier phases. As we get into the vaccination process, however, we're hoping that those volunteers, having been vaccinated, would be more willing to help.
Commissioner Trieger, did I see your hand up?
You did, but I believe Commissioner Farr's hand was up before mine.
Are you usurping my ability? No, I'm just kidding you. That's fine, Commissioner Farr. I apologize.
Chair Bernie, Steve, thank you very much. Chair Bernie, I'm going to defer to Commissioner Trieger, and here's why. It's been my experience that other commissioners will ask questions, eliciting responses from staff that I might have asked myself, which makes it so I don't have to ask those questions, and staff doesn't have to repeat themselves. So I will have a couple of things to say, and I will anticipate that there'll be some questions that other folks don't ask before you come to me in the queue. But at this point, Chair Bernie, I would like to defer to Commissioner Trieger and step into the queue subsequent to that. Thank you.
Is that all right with you, Commissioner Trieger?
That's great, thank you. I have one just logistical clarification question, and then the other something a little more discussion oriented. You mentioned waiting for a second round of doses. So as more people are vaccinated with first round, then we'll start having this sort of rolling deadline of who needs their second dose. So are we waiting for a second round of first doses, or is it just a second round that could be some people's first dose and some people's second? That's my one logistical question. And then I have a second question.
Oh, indeed, and Chair Bernie, thank you, Commissioner Trieger. It's a bit of both. Early in the process, we heard from local providers that they were holding their initial shipment to be able to cover 2 doses. Very early in the process, OHA really addressed that issue pretty early on and indicated that all early deliveries should be delivered as first doses. So they were asking providers locally not to hold those back. And it really, because it's kind of a push system, the more doses you deliver, the more vaccine you can, right? So you're demonstrating that you have the ability to move vaccine. And I think that is kind of a good incentive early in the process. We are many of the so in the instance of Springfield Fire, they are in fact awaiting a second shipment that will enable them to complete all of their first doses. And indeed, both of the vaccines with which we're working, the Pfizer and the Moderna vaccines, have very specific second dose requirements, and there's kind of a peak efficiency for the vaccine, if you will, that is kind of a 72-hour window. So for the 21 days or the 28 days, there's a real incentive to try to ensure that you hit that target for the second dose as well.
Great, thank you. My other question is, these are big buckets, these different categories of folks. And so can you share with me a little bit of some of the conversation about prioritizing within those categories? And specifically, I'm thinking about how we all know communities of color, for example, experience disparate health outcomes for a number of reasons. And of course, we're also seeing that surface with COVID and who's impacted and how, as well as I'm particularly concerned about people who are the primary or solo caregiver, not because it's their job, and so through employment, they're going to receive vaccine, but because they're a family caregiver. So can you share a little bit with me about sort of the subdivisions within those larger phased groups, those conversations about prioritizing?
I can, and Chair Bernie, thank you. So there's within these kind of groups, there's a multi-page guidance document that really kind of breaks down, many referring to specific statutory references to try to define what a particular thing is or category. As the phase 1A piece is really very highly focused on the healthcare provider community, the first 2 groups kind of institutionally oriented, and the second 2 groups being more focused on outpatient settings. Group 3 is outpatient with higher risk and medically fragile patients and patient contact. And then Group 4 rolls into kind of the broader outpatient healthcare community, which ranges from your specialist to your chiropractor to, your acupuncture person as well. So the guidance that we've gotten from OHA really does not go beyond phase 1A at this point, these 4 groups. What we do know is that in 2 days, a state-convened, OHA-convened vaccine advisory team will be sitting to provide additional guidance. That team has been very purposely composed of individuals that are representing communities of color, indigenous and other race, ethnicity characteristics, age, and individuals with other health challenges to really begin to provide that guidance to OHA. I would note that much of the guidance is really couched very deeply in ideas of health equity that OHA has embraced. The initial plan that they submitted to the federal government back in October, the first 15 pages of that document really detail issues of equity, and we see it already kind of beginning to manifest within this phase 1A. But we anticipate as we get further into phase 2A or phase 1B rather and 1C, that we will begin to see some of that guidance being manifest much more in a way that is much more helpful for us in terms of thinking about how to administer programs here locally.
I'm going to move on here. Commissioner Farr, would you like to speak after Commissioner Bozovich or before?
I'll step in right now. Commissioner Bozovich, I'm confident will ask questions that I wouldn't dream of asking. So I'll ask my questions right away, and then turn over to Commissioner Bozovich. And Steve, Chair Bernie and Steve, I don't want to ask you to repeat questions. And I think the 2 preceding commissioners asked very good questions that I took extensive notes on. I won't go into those. What I'd like to talk about more specifically is what then is the Board of County Commissioners' role in making certain, as Mr. Mokrahysky said earlier, that we can proliferate accurate information to our constituents, to the people of Lane County. We represent people in Lane County 2 different ways. One, we represent our districts, the people who specifically elected us in our district, but more significantly, we represent the entire Lane County. And each one of us has a pulpit that we stand upon, where people will listen to us. For good or for bad, people will listen to us. And as much as we'd like to believe everybody in the world is watching this meeting, really it's a pretty small number of people that are watching this meeting. So what comes from this meeting is far more important than what is actually talked about repeatedly at this meeting. So that being said, Mr. Mokrahysky said he would like to call upon commissioners to, and I'll kind of revise his words, to help proliferate the actual order of the vaccinations and the very specific information that people are asking. I believe that we have a relatively short checklist of questions that people are asking on a regular basis. It's a very mysterious process. And as you have stated, it continues to be mysterious because it's dynamic. It changes all the time. And even though we do have a set protocol for vaccination in Lane County, it's changing. Consequently, my one question is, can you answer what is the specific role of Lane County Public Health in determining the order of distribution and actually participating in the distribution? Second part of that is, how might that change as the distribution increases?
Chair Bernie, thank you, Commissioner Farr, for the question. To the question, so our role right now is more information broker than vaccine broker. Really and truly, we are trying to connect folk who are looking for vaccine within Group 1 of Phase 1A to those who have it, and understand how quickly it is moving. I think to your second question, how will the role of public health evolve over the coming weeks and months as we go? I think we continue in that information broker role in terms of trying to keep you updated, update the general public, help people understand where we are in the process. And we then also, I think, take on a vaccine broker role as well. As we have excess doses, we have the ability to redistribute that following the state guidance. Our intent as we go is really, I think, we're some of the principles are, efficiency is a high issue for us in terms of getting this work done. Flexibility has to be built into our system. We have existing plans, but we're coming up with Plan B and Plan C and Plan D to the greatest extent that we possibly can, so that we can be as flexible and as modular as we must, and continue to do this. Thirdly, I think transparency has got to be a key criteria here. And I am afraid that in the coming weeks, as I brief you on vaccine updates, I will continue to tell you that I don't know things, or that what I told you last week has now changed. And these are the new facts on the ground. So those are the kinds of things that we anticipate our role to be. We will be communicating more broadly, obviously, beyond you as our governing board, to the broader public, and trying to ensure that people understand, not only through our traditional media outlets, but also through at whichever phase we are, and whichever kind of group we are, our communication methods will change in order to try to maximize the number of individuals that are being vaccinated.
Excellent answer, and one that I really did anticipate, Mr. Adams. Chair Burney, I'll continue briefly. It illustrates the importance then of the Board of County Commissioners specifically to have accurate information as timely as possible, in that, as you said, you may this afternoon say, I don't know, to a question that you thought you had an answer to this morning. So our role can be, and has to be, providing a level of confidence to the people of the county that we are doing our best to administer what is a well-established vaccination protocol. You mentioned the meningitis outbreak. I happen to be in Washington, D.C. at the NACO's health conference during when that happened. And Lane County was a topic of discussion at that health conference with representatives from all of the nation. We did a superb job during that event. We need the people to understand that we have a good team of operators on the ground, ready not only to exercise our protocol, but to be very changeable as the dynamics of this situation occur. And I think that's one of the most important roles of the Board of County Commissioners, is that we have the same message on a consistent basis, and that we all give it as frequently as we can with the updated changes. As I mentioned, I believe there's a short list of questions. People are mystified by the vaccination process, completely mystified. I think you can look around the screen right now and you'll see mystified people even here. And we're getting the first line of information. So it's important that we're able to say the same things as a board, and establish the confidence that while things are changing, we are doing our best and succeeding in staying ahead of the curve. Mr. Adams, thank you for your work. It's a pleasure to see you and to read your updates daily. And I look forward to, once again, having the first line of information that we can pass along directly to the people who need to know. Thank you, Chair Burney.
Chair, just a quick comment, if it's all right. In everything that Steve Adams said is certainly accurate, and just to provide a little bit additional information and to put a point on the fact that Lane County is not the only agency receiving vaccines in our community, right? Numerous agencies are. So we are not the distributor or even primary facilitator of vaccines. Peace Health, Mackenzie Willamette, Eugene Springfield Fire Department are three of several in Lane County Public Health, are all separate organizations that have received vaccines that are then administering those vaccines to the populations that OHA, that the state has defined within those groups. One of the roles of Lane County is, and this is important for our commissioners representing, and for all of you representing the rural areas, is to help support those smaller rural communities. So for example, the EMS staff that are in rural communities that aren't large enough, like Eugene Springfield, to actually receive hundreds or thousands of vaccines for their staff. So it's one of the things that we are also helping to support as the initial vaccines that Lane County Public Health received are for health care workers. They're also for EMS and frontline public safety workers that don't work for Lane County, but that work for other rural public safety agencies. So I just wanted to add that point. And then, we will continue. We're doing daily messages to various groups, and the commissioners are included on all of that. And so you will see additional information coming out daily on vaccines, and we encourage you to continue to share that.
Chair Mokrahysky, thank you for that. But it does underscore what my takeaway from Mr. Adams's response to my questioning. We are currently basically an information broker. It's important that we're brokering good information. Thank you.
I'm sure there must be someone else that wants to make sure that Commissioner Bozovich does not have an opportunity to speak. Commissioner Bozovich.
Thank you, Chair Bernie. Steve, my question is somewhat along the same line of making sure we're getting good information out, but I'm going to completely change the topic from vaccines testing. There's been significant social media discussion over the last month about testing sensitivity and number of extractions or repetitions and actually getting positive tests that are somewhat meaningless because the viral load is so low because they're doing such a great number of extractions to where the state of Florida has started to report differently their testing results. And I'm not expecting an immediate answer from these two questions because they're pretty technical. But I'd like to understand maybe, is Oregon going down in that high number of, and I'm not even sure I'm using the correct term, number of extractions to where we're giving positive test results to very low viral loads compared to other states, which would jump our positivity rate and our case counts up.
Okay.
And trying to understand that because there's quite a lot of discussion on social media that makes it sound like that's why we're seeing, quote, some of our surge is there's been changes in some of that. And I've also seen some very interesting discussion on the technical side about should we be using the highly sensitive test less often, like the PCR, or should we be using lower sensitivity tests more often because we'll be more likely to catch somebody on the upswing of an infection versus detecting somebody that's past their high viral load and calling that a positive case after they've actually gone past that. And I just kind of, these are kind of technical testing questions. So I expect you may have to go back to Dr. Lugke or somebody like that and ask those questions. But so it's two questions. One's about, is Oregon doing anything different from other states relative to our number of extractions and testing sensitivity to where we're getting very low viral load positive tests? And also, is there some, is it better for us to maybe move to these rapid response, lower sensitivity tests more often versus the high sensitivity PCR tests less often? And, what should our strategies be? And as a public health agency, what should we be pushing for as far as resources from the state? So those are the two questions I have. And I was pretty sure Commissioner Farr wasn't going to ask them, so I didn't mind waiting till after.
I'm sorry, Chair Bernie.
Go ahead.
No. If there's a response, please go ahead.
Chair Bernie, I appreciate the question from Commissioner Bozovich. I will tell you, I do not know on the first question with respect to additional extractions and lower sensitivity. and the differences here in Oregon leading to higher positive rates vis-a-vis Florida, for instance. And that is most assuredly a Dr. Ledke question that I will follow up on for you, sir. With respect to the rapid testing strategies, I can answer, and I will likewise follow up with Dr. Ledke to ensure that he keeps me honest. The guidance that I'm aware of is that the rapid testing is an appropriate, it is really much more effective in symptomatic people versus asymptomatic people. And so, in fact, he was just sharing some very recent science published in the New England Journal of Medicine last evening with the providers in Lane County on that very issue. The rapid testing is an appropriate tool for testing populations on a regular basis. So if you have a particular population that you're testing daily or frequently throughout the week, that gives you sufficient signal in terms of what's happening within that population. So you can see that being implemented in a workplace, for instance, or in another kind of closed bubble, if you will, to kind of see what's happening. If you're doing spot testing with rapid testing, as we have for the most part for the general population, the PCR testing I think is still more strongly recommended, particularly for asymptomatic people.
I guess that probably reinforces one of the things I'd like to see, which is rapid testing being used frequently in nursing homes and in long-term care facilities, particularly of staff. So we are getting that frequent, with our most vulnerable, folks out there that have frequent and close monitoring of whether or not we're seeing an infection or something pop up in that population. And that's kind of where I was leading with this, is where do we do that? Because obviously it's happening for college athletics and other places where we're getting rapid tests done on a frequent basis. And you're seeing them catch teams across the country that are starting to have outbreaks before they and canceling games, et cetera. I'd like to see that same kind of news happening relative to our long-term care facilities, that we're catching something before it really gets bad, and then we're doing something to shut down and control the situation, rather than hearing about the number of deaths coming out of a particular facility. So that's somewhat where that question was leading. The other question has more to do with just trying to make sure we're getting good information out there, because we're a lot of people think that the high risk matrix and all that stuff is due to the fact that we're running so many extractions, et cetera, and getting a high case count, high positivity rates in Oregon that really aren't there. And that's the sort of information that needs to be, I need an expert to tell me one way or the other, so I can get back to some of those people and say, it's not really true.
Okay, I have a question. I recently was able to see, actually thanks to, I was Chair Buck, because Chair Buck was chair when I received this information, some warning week risk level data. And that warning, if I read it correctly, that warning week risk level data had a positivity rate in Lane County, which is at extreme level, that was lower than other counties that were not that high of a level. Can you explain that, or am I reading that incorrectly?
No, you are reading it correctly, Chair Bernie. So just as I fumble through my papers to pull up that particular sheet. So the criteria is, it's kind of a two-part.
Forgive me, because the reason I ask is the impacts of that are so significant to so many people in our community. I get the discrepancy, and thank you, sir.
Oh, of course, Chair Bernie. So it's a two-part test for which risk level that you fall within. So for large counties, it is the test of essentially the rate of COVID-19 cases per 100,000. And this applies to the counties with 30,000 or more people. It's that and the percentage test rate, right? So you have to hit both thresholds in order to move down to the next level of risk. For some of the counties, for the counties with less than 30,000 people, it's simply the number of COVID-19 cases over 14 days and the test positivity rate. So you can see in a smaller county, a reduction in just a handful of cases can in fact be attributed to both of those characteristics. Our test positivity percentage over 14 days, as you saw on that latest data poll, has remained below the 10% threshold. The next highest level is high risk is 8 to 10. But we're still at about 253 cases per 100,000. So we don't meet that criteria to move down to the next level.
Okay, and forgive me, but in any environment I've ever been in, be it business or education or nonprofit, certainty is always aspired to in order to make good decisions. I heard you say that you're getting weekly and sometimes daily changes in guidance, and that's really concerning to me. And I'm wondering if you could elaborate on that a bit.
I can, and thank you, Chair Bernie, for the question. The weekly and daily changes in guidance have really been, in large measure, focused on the vaccine delivery process. So that is where we've seen the greatest degree of change. I think with respect to the risk levels, we have not heard or I have not seen any information coming from state government around changes in the risk matrix that may be contemplated within the governor's office or at OHA, with the exception of the school guidance that I mentioned earlier. And so the governor announced on the 23rd of December this changing that from a mandatory guidance to an advisory guidance. That is the biggest change that I've seen with respect to kind of the risk side of the equation.
Okay. Well, while we've been off, there's been so much news on this. We're going to have to make up the time later, but does any other commissioner have any other question at this time? Mr. Adams, thank you very much.
Thank you, Chair Bernie and commissioners. I am grateful for the time.
We are now, forgive me, technology is not my friend. We are now moving to consent calendar, I believe. Item 7. Do I hear a motion?
Mr. Chair.
Yes.
Sorry, just a note that Commissioner Trieger had asked for item A1 to be pulled.
I just remembered that. Yes.
Okay.
So I apologize, Commissioner Trieger. With item A1 being pulled, do I have a motion for approval of the consent calendar? Commissioner Farr.
Chair Bernie, I move approval of today's consent calendar with the exception of item A1, which has been pulled for further consideration.
Is there a second?
Second.
It's been moved and seconded to approve the consent calendar with the removal of item A1. All those discussion. All those in favor signify by saying aye.
Aye.
Opposed? And the motion carries unanimously. Yes, Commissioner Farr.
I'm sorry, Chair Bernie, I was going to make a motion for to approve item A1 from the consent calendar.
You never need to be sorry. Is there a second?
Second.
Second.
It's been approved and seconded twice that we approve item A1. Discussion. My understanding, Commissioner Trieger, is that you wanted this pulled simply because you were not at this meeting and could not, in good faith, vote one way or the other. Is that correct?
Correct. I will abstain from voting on this, and I didn't want to have to abstain from voting on the entire consent calendar. Thank you for clarifying.
Perfect. Okay, all those in favor, please signify by saying aye.
Aye.
Opposed? Same sign. And the motion carries 4-0 with Commissioner Trieger abstaining. Okay. Item 8, Public Works. Order 21-01-05-15 in the matter of appointing an at-large member to the Lane County Planning Commission. And I believe we have Rachel Surslav with us to discuss this item.
Thank you, Chair Bernie, and good morning, Commissioners. This is Rachel Surslav, Associate Planner, and I'm here before you today for the appointment of one new member to the Lane County Planning Commission. On December 1st, 2020, the board appointed a subcommittee consisting of Commissioner Bozovich and Commissioner Buck to conduct interviews with candidates for 2 vacant planning commission positions. Of 3 candidates that applied, Kathy Smith was selected as a finalist, and the subcommittee recommends today to the board to appoint her to the Planning Commission. Therefore, staff is also recommending and supporting that the board move to appoint Kathy Smith to the Planning Commission for a first term. And additionally, the board has directed staff to schedule a second round of interviews with the 2 remaining candidates in order to fill a second vacancy on the Planning Commission. And staff is working to schedule those interviews with Commissioner Trieger as directed by the board. And I do also want to note that since the interviews were held, staff has received 1 new application for the vacant position, for the other vacant position, because those positions are open until filled. And that concludes my presentation. Thank you very much.
Thank you, Ms. Surslav. Are there any questions or comments? Seeing and hearing none. Is there a motion?
I'll move approval of the order.
I'll second.
I'm sorry, who seconded? Heather?
I'll second.
Thank you. Commissioner Bozovich moved and Commissioner Buck seconded order 21-01-05-15. Further discussion? Hearing none, I will call for the vote. All those in favor of this order, please signify by saying aye.
Aye.
Opposed, same sign. And the motion made by Commissioner Bozovich, seconded by Commissioner Buck, is approved unanimously. Item 9A, Health and Human Services, Order 21-01-05-16, in the matter of approving 6 contracts and 3 amendments and delegating authority to the county administrator to sign the approved actions. And we have to discuss this, Ms. Karen Gaffney.
Good morning, Chair Bernie and Commissioners. There are 6 contracts in this board packet. I would just want to lift up a couple in particular to talk about, but of course I'm happy to answer questions on any of those that you might have. The 2 in particular that are new contracts that I'm want to lift up for you because they're related to our goals around implementation of the TAC report and really addressing our housing and homelessness issues are the shelter care rapid resolution contract and the Carry It Forward outreach contract. And both of those are new and particularly exciting for us as a department. The rapid resolution, you might recall, the board talked about this in the context of how do we divert people from moving into our homeless system. So rapid resolution is a key strategy to be able to make that happen. And this particular project works with shelter care to establish at least 3 system-wide rapid resolution specialists who will work across various access points in collaboration with outreach and shelter service providers to assist at least 500 households per year to identify an immediate safe place to stay within their own network of family, friends, and social supports, even if that's temporary. And then work with them on focused, deliberate problem-solving conversations to help create a plan then for more permanent strategy. So it's exciting for us to be able to add that resource into our service delivery system. These specialists will also provide some basic follow-up services and supports. They have access to a small pool of flexible funds to be able to help, again, have people avoid moving into our homeless system in general. And then the second one that I want to talk just for a moment about is our contract with Carry It Forward for outreach. This contract will establish at least 2 outreach workers and a half-time supervisor at Carry It Forward who are going to provide that strategic, targeted, organized outreach services to approximately 150 single adult households annually. And this project is focused on East Lane County. So we'll be working in close coordination with our own human services staff in order to really coordinate with our coordinated entry system. But the focus of this team is going to be in, as I said, Eastern Lane County, including Springfield and outlying rural areas. So it's an excellent opportunity, again, for us to really broaden the impact of those strategies and have people on the ground working closely with individuals who are unhoused in our community. And again, of course, this team is going to collaborate with our community partners as well as city and county partners to meet the basic needs of those individuals. So I know you have a limited time. I'll stop there, but I'm happy to answer questions about any of the projects that are on this list.
Commissioner Farr.
Thank you. Thank you, Chair Bernie. Ms. Gaffney, I have extensive questions and comments regarding all of the projects on the list, but this is not the time to engage in that. I wish we had a little bit more time because a couple of these really need to be called out, I believe. You know, we have contracts with the long-standing nonprofits that are delineated here with shelter care. And Michelle Hank is the new director of shelter, relatively new director of shelter care, is doing a superb job of guidance there and moving things in the right direction. But what I wanted to point out is there are a couple of newer nonprofits that have been operating in Lane County that we are both legitimizing through these contracts and also helping them to grow in the absolutely essential and singular way that they can provide services. Those are Occupy Medical, which has been around for a while, but they've been kind of, they used to operate in on the park blocks once a week, and now they are providing their type of medical relief to the people who need it first. Relief such as foot care. Now, if you've never had a bad foot that's chronic, you don't know how disabling that can be. Well, if you look at the work that Occupy Medical does and that we are helping them to proliferate through both legitimization of their work, which has always been legitimate, but by recognition of it, it's really helping them to do something that nobody else is doing. And they really are remarkable. It's Sue Sierra Lupe and the staff and the professionals and the volunteers are amazing, and the peer counselors. And the second one, of course, is Carry It Forward, which is rapidly becoming one of my very favorite and most effective nonprofits. Carry It Forward's been once again legitimized, even though they've been doing legitimate work. They've been mainstreamed more by Lane County several times in the last couple of years by helping them with their contracts and helping them to provide services that nobody else was providing. They do it very, very well, and they are continuing to expand in that service. So, Ms. Gaffney, I just wanted to point those two out and say, superb job in recognizing unique providers who are able to do things that other people simply aren't able to do in a much more in-depth fashion than we've been able to do it ever in the past. So thank you very much, Chair Bernie.
Are there other commissioners that would like to either make a statement or have a question? I noticed, Karen, let's just take one of these items we're voting on, which is a revenue to the county from Oregon Health Authority for a mere $25 million. How much of a departure is that from our previous contract with them? And if so, please explain the deviation.
Thank you, Chair Bernie. And I appreciate the question. And I know these are considered in the way we approach the board as routine items, but that absolutely doesn't mean that they're small items or don't have significant impact in the community. So that particular revenue agreement, we consider routine because it is a renewal of our annual agreement with the Oregon Health Authority for our behavioral health funds that flow from the state to the county. So this particular amendment and financial assistance agreement renewal doesn't represent a significant change from our status quo. It's the funds that are allocated to us by the legislature that flow down to support behavioral health services, both that we provide in-house in Lane County and then some that we subcontract out to providers as well.
Thank you. And I would also want to reiterate that we don't seem to have as many mechanisms as I would have liked to support the growth and development of non-governmental organizations that reach into the nooks and crannies and truly help the most needy and fragile among us. So, for those in the public or commissioners that really want to dig into this deeper, our ability to not only fund, but to guide and to help structure the work of some of these nonprofits is really community building, I think, at its finest. And I just wanted to comment on that.
Thank you, Chair Bernie. And I would say in Health and Human Services, that principle has been front and center for us for a long time in how we partner with the nonprofit community. And I know we say this annually during the budget process, but I'll underscore it here, that there is no way we could do the work we do as a department without the variety of nonprofits that we have in the community who really partner with us and serve as subcontractors for us. I appreciate Commissioner Farr lifting up two of what people might think of as less traditional partners in that, but you're absolutely right. We partner with nonprofits, small and large, in the community in order to deliver the services that we do.
If there are no other commissioner comments at this point, the chair will entertain a motion. Commissioner Bozievich.
So I'll move to approve Order 2101-05-16 in the matter of approving 6 contracts and 3 amendments and delegating authority to county administrators to sign proof actions.
I'll second.
It has been moved by Commissioner Bozievich and seconded by Commissioner Trieger. And Commissioner Bozievich's hand is telling me that this is the time for further discussion on the motion.
Thank you. I just want to note quickly that 2020 ended, with another down note in that on the 31st, we got a decision from a federal judge here locally that is putting in jeopardy that $25 million contract and our ability to continue providing behavioral health services. I will be discussing that ruling, I think, in executive session with legal counsel, but the actual ruling is public record from Judge Aiken. If anyone wants to look it up, it's dated December 31st, 2020. Like 2020 didn't have enough bad news in it, but just to make the board aware, we're walking on some pretty strange waters when it comes to providing these services relative to our liabilities.
Thank you for that. Are there further comments? If there are no further comments, it has been moved by Commissioner Bozievich, seconded by Commissioner Trieger. Order 2101-05-16. As per the motion, all those in favor, please signify by saying aye.
Aye.
Aye. Opposed, same sign. And this motion is approved unanimously. Item 10, County Council, 10A, announcements. Mr. Dingle.
I do not have any announcements, and I'm ready to proceed to item 10B.
Well, in lieu of announcements, be our guest.
Thank you, Chair Bernie. This is really, I think the members have seen this before, but for Commissioner Trieger's benefit, 3 or 4 years ago, the board went through a emergency preparedness sort of tabletop exercise. And what came out of that is a series of emergency related and disaster related board orders. And 2 of those, you'll see those, they're up above in the consent calendar. But these 2 by definition are pulled out each year so that the board has the opportunity to visit them or revisit them individually and see if anything should be changed. The first one, ending in 17, was just the agreement that was reached by the board on how they would get together and communicate in the event of an emergency. 18 is the one that extended to the county administrator the ability to spend beyond his authority in the event of an emergency, because his authority in the county is capped at $100,000 unless the board authorizes otherwise. And we found that, and obviously in these emergencies, the administrator can quickly exceed that $100,000 before the board can get back together again. The only thing I would recommend is that the board carefully consider, I know we've bumped up Mr. Mokrahajski's authority in lieu of what's happened this year. My personal feeling is that it's worked, these 2 things have worked very well. The authority to the administrator, because built into it is he reports back and basically in a sense provides a bit of an audit to the board on how the money has been spent. And when the board has authorized more spending authority, he's kept the board apprised of how much money remains of that authority. So that's really all there is, unless particularly you, Commissioner Trigger, have any questions about those 2 orders.
Thank you. I don't.
That's all I have, Chair Bernie.
I see something else by your name, Counselor, order 21-01-05-18. Is that correct?
Yes, I thought I addressed both of those. 17 is the one that just described, and then 18 is the one that deals with the administrator's authority.
And do we need a motion for that order?
You need a motion for both.
Okay. So we have in front of us orders 21-01-05-17 in the matter of notifying board members of emergency meetings and board participation in emergency meetings. Do I have a motion for that?
So moved.
Second?
Second.
Moved by Commissioner Bozovich, seconded by Commissioner Buck. Further discussion? All those in favor of order 21-01-05-17, please signify by saying aye.
Aye.
Opposed? Aye. Opposed, same sign. And this motion is approved unanimously. Going now to item 10C, order 21-01-05-18, in the matter of authorizing the county administrator to expend and commit county resources during the emergency until an emergency meeting of the board. Is there a motion there?
So moved.
Moved by Commissioner Bozovich. Is there a second?
Second.
Seconded by Commissioner Trieger. Discussion. Commissioner Bozovich.
So before we leave this subject, I just want to, maybe make some of the board members that, particularly Commissioner Trieger, aware that once upon a time ago, we didn't do this every year. And our emergency preparedness wasn't exactly a high priority or well thought out at the county level. Commissioner Farr, when he was chair, got to witness that when the Yellow Point fire broke out in my district, and on a Friday afternoon at 5 o'clock, and how to make decisions around allowing Oregon Department of Forestry to utilize a county facility as a fire camp on a Friday evening was not well laid out. And
it's early Saturday morning, actually, Jay, but that's fine.
yeah. By the time they asked, it was early Saturday morning. But yeah, you can imagine that there was not a lot of people around to talk to, and it was a tough thing to deal with, and he took the bull by the horns and took some liability on himself and made a decision and allowed ODF to use that facility. But we realized at that point that we needed to have procedures in place for both how we call emergency meetings, how we talk to each other if we're not available, because when we ran a tabletop, one of the things that we realized was what happens if you can't necessarily get a hold of a commissioner like this on video or by computer. The only thing they have is text available. Is that considered attending a meeting? And kind of predefining some of those things so that we aren't worried about the legality of whether we have a quorum making a decision. And that all this, was thought out as, after the Yellow Point fire, the next year I was chair and spent the year concentrating on resilience and emergency planning. And I think what we saw this year was between our Health and Human Services and our COVID response and the emergency operations that was set up for that and the fire response that we had, we've come a long way. And I just can't say enough about where our county is in our ability to respond to emergencies, implement the incident command system in accordance with federal guidelines from FEMA and Homeland Security. We are just so far beyond where we were 6 years ago. And it really showed this last year. And I just want to thank our staff for the work they've done to move us ahead on that. And particularly County Council and our County Administrator have done amazing work on that. And we were fortunate this last year that we had moved so far, the needle so far, because we saw a really successful response. And in fact, I was getting lots of calls after September 7th from other county commissioners about how we managed our fire because of how well we did our evacuations, how well we handled everything. They're looking to Lane County as a leader in emergency response now, rather than where we were with the Yellow Point fire and going, who's on first? So we've come a long way, and that's why these two orders come up every year now and why they're so important, because we just don't know what's next. Hopefully it won't be another 2020. We won't get to test them in two major emergency operations. In fact, it was actually three, because we kind of forget the Sweet Creek fire was in there also. But it's just really important work that we do and something that we manage here as a county, and we do it well.
And Chair Bernie, if I could just add one other thing for Commissioner Trigger's benefit, it really does help in these emergency situations that the rules are agreed upon before the emergency. It lessens friction, it lessens controversy. Everybody knows exactly what's going to happen. And that's why it was so important to get these, in particular, number 17, done, so that the board had agreement and consensus about what was going to happen in the event of an emergency, and we weren't doing it on the fly.
Soon we're going to be needing instructions on what to do in the event that we don't have an emergency. Forget it. Are there any other comments? Yes, Commissioner Trieger.
Thank you, Chair Bernie. I would love for there not to be an emergency ever, but that's unlikely given the state of things. And so in particular, I want to appreciate the support of my colleagues on providing some background, but also for the benefit of anyone in the public who may be watching, or folks in the organization who are newer to the organization. I do, again, appreciate the support and the background information, but a reminder, I did serve on the county's budget committee from 2015, 16, and 17, and recall some of the conversations and discussions around expenditures and order in which and procedures for doing so. Also, Of course, and admittedly, the organization that I ran was much smaller in scale. The same principles apply of wanting to ensure that your chief administrator has a certain amount of autonomy within legal limits. So I really appreciate and I'm very familiar with these kinds of procedures where there are advanced prescribed exceptions to how we do things like allocate expenditures in the face of emergency. I think it's especially important, as we've all learned this last year, with the climate crisis only worsening, increased wildfires, and the attendant mudslides and floods and so on that are likely to come as a result of them, are things that we are going to be facing without question in the future. So I very much appreciate the commitment to increasing our resources and our attention to disaster planning and preparedness. And thank you all again.
Well said, Commissioner. I can recall 2 years ago when I started, I did not have the background you have. And so I was enjoying, up until about 3 weeks ago, sometimes Mr. Dingle or others would say, well, for the benefit of the new commissioner, and I just thought, well, I don't know how long I can milk this for, but I think it's officially over. But I really appreciate your comments. Are there any other comments? Hearing none. I would like to make one more. And this is just for Commissioner Tree. No, I'm just kidding. One of the things that I have learned is that sometimes we will go into a particular area in detail, and it's not for our benefit, but it's for the benefit of those people in the public that have not brought certain issues to attention. That's just my comment. If there's no further discussion, I'm sorry, Commissioner Buck.
I just wanted, excuse me, I just wanted to clarify in the beginning, I had seconded, so just so you know.
I am so I apologize. Okay, thank you for the clarification. The motion was made by Commissioner Bozovich, seconded by Commissioner Buck, to approve Order 21-01-05-16. All in favor, please signify by saying aye.
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 Opposed, same sign. The motion passes unanimously. Thank you, Mr. Dingle. Because I can now see Mr. Mokrahajski pressing his button, which means he's about to say something, I noticed that we're on now item 11A, County Administration Announcements.
Thank you, Chair Bernie and Commissioners. I just have, I don't have anything really substantive or new for you, but I did want to do a couple of recognitions. And first, a congratulations to our newly elected officials, to Sheriff Harold and DA Perlow and Commissioner Farr and Commissioner Trieger, who are all elected and sworn into office yesterday. Congratulations to you on your elections and your oath of office. And a special welcome to Commissioner Trieger, who is new, a newly elected official, new to this board. And I just want to offer, on behalf of our executive leadership and the staff and the organization, how much we're looking forward to working with you as a new commissioner. We've had the opportunity to have a couple of one-on-ones, very sort of brief, high-level county one-on-ones, and I know that Commissioner Trieger is going to be setting up some virtual or in-person tours as is possible, and is anxious to get out and meet with staff and review issues and see sites. And I just want to say that we all are, Commissioner Trieger has in prior meetings acknowledged, as all of us when we're new to positions, what she has to learn. But I will also say that our staff is very much appreciative of the vast knowledge and experience that you bring to this role, as having served on a budget committee for the county and an equity and access advisory board, as well as all your roles in various service-based organizations in our community. So we're really looking forward to not only working with you and sharing information with you, but really also learning from you and your experience. One of the things that we really value about the Board of Commissioners is not only how you function as a body and you come together as a team to make decisions, but how each of you bring your own, not only your representation of your districts, but your own unique lens and experience and background and perspective to your roles, and our staff and our community really benefit from that that insight and that experience. And so Commissioner Trieger, we know, will bring a unique set of experiences and insights. So welcome to you, Commissioner Trieger, and look forward to working with you.
Thank you.
Secondly, I just want to briefly recognize Commissioner Buck, who for the past year, we said this is kind of, I guess, my point of personal privilege here to recognize a few folks. Commissioner Buck, again, for the last year of service as our chair, really the last 2 years, serving in leadership as the vice chair 2 years ago, your first year on the board, and then as chair this last year. And we've acknowledged what a difficult and challenging year 2020 was, not only for COVID-19 early on, but also for the wildfires and how that impacted, not only brought you your leadership, required your leadership as the chair of the board, but also representing the district that was impacted, and just the really solid and steady leadership that you provided throughout 2020. So on behalf of our executive leadership and the staff and the organization, I want to thank you for everything that you did to play the role that we need the chair to play in those instances. And then the great state of the county yesterday in a unique situation. We've never done that in the time that I've been in the county, where we've had this kind of virtual thing and everyone did their swearing in a new way, and it wasn't as ceremonial and sort of fun, and it didn't cap off sort of all of these momentous things that have happened in the way that we're used to. But I thought that it was really well done, and in an appropriate way that we needed to do. So thank you for that. And I also want to acknowledge Devin Ashbridge, who did a lot of the behind the scenes work to pull that virtual piece off, along with Diana Jones. So thank you there. And then finally, I just want to take a minute to acknowledge someone who oftentimes does a lot of work behind the scenes and doesn't get the recognition. Jocelyn Warren, who is our public health manager. We oftentimes see Dr. Ludke. He's like our local Dr. Fauci, right? He's like the person. I think we need a Dr. Ludke a bobblehead or something, right? He's like the person the community looks to. He's on our KLCC radio every Friday, and we look to him for questions. He's very public facing and does an incredible public health expert for us locally. Our public health team, we've recognized there's communicable disease and public health nurses here at the board. The incredible work our public health team has done in the past year in particular. It just coming in every day, and the contact tracing, and now through the vaccination process. And so we've really tried to call out all of that work that our public health team has done, the incredible work they've done in the past year. And I also just want to acknowledge that, in order to sustain the kind of response that we've had for a year now on this incredible pandemic that is truly a once in a lifetime response effort, it really requires strong and steady leadership. And Jocelyn Warren has been at the forefront of that. And I just want to call out, she, when I started in 2014, we didn't have a public health manager. We had struggled to hire a public health manager. And we had to sort of do some reworking and go back out, and we did a really aggressive effort, and we were successful at hiring Jocelyn in January of 2015 from a research career in health management and policy at Oregon State's College of Public Health and Human Sciences. And she has just, over the past 6 years, done incredible work that I think oftentimes has gone overlooked. And so that's my responsibility. I want to take a moment just to recognize that under her leadership, Lane County Public Health has achieved the goal of becoming a nationally accredited public health department. That is not a small feat. That took several years to do. It's really a remarkable accomplishment for her and for the public health team. And it's an acknowledgement of the high quality of the work coming out of our Lane County Public Health. That happened before COVID-19 and really set us up to give us the ability to have the type of response that we've had. Jocelyn was also selected by the National Kresge Foundation as an emerging leader in public health, which is an elite cohort of individuals selected from across the country. She is currently and was voted by her peers as the chair of the Oregon Council of Local Health Officials. And her tireless energy, and I have seen this, it doesn't oftentimes get recognized publicly, but many of us have seen the tireless energy and talent that she has brought in bringing her team together and maintaining the sort of, not only the technical expertise, but the leadership and the motivation and the support needed for all the public health staff, the recognition that she has gained both internally in the organization and externally among our community partners. Her deep focus on equity and the impacts of the disparities throughout her decision-making. She was early in COVID-19 to call out and identify the issues that COVID-19 was having and on the disparities of health impacts on people of color. And she made very intentional efforts in directing resources to address those impacts with higher case rates, particularly in the Latinx community. We've done intentional things like outreach on testing, and now the work on looking at getting vaccinations out to those communities of color. She just has dove deep into the issues of homelessness during the early parts of the pandemic, forging a partnership with Occupy Medical to operate 100 River Avenue. So we do these things like we act really quickly and say, let's go get 100 River Avenue. And then we have people like Jocelyn who step in and go, well, we actually have to operate that, right? And how are we going to go about doing that? And we don't have the staff to do it. So she really led that effort to build that partnership with Occupy Medical and make sure that that facility, which has been critical in isolating and quarantining unhoused individuals who don't need to be hospitalized, but who've been exposed to or tested positive for COVID, to limit the further spread. So I could go on and on and on, and I just wanted to take that moment to recognize her, because I've realized that now, nearly a year into COVID-19, she has just led this effort and sort of quietly behind the scenes for many folks, not been called out at the same time that we are calling out the incredible work of the folks at the line level and at different parts of our organization. So I just want to give a shout out to Jocelyn and a big time thank you for the incredible work that she and her team have done and the leadership that she has brought to that. So thank you for those, I guess, points of privilege, and I'm done unless you have other questions for me.
I'm sorry, I was unmuting myself. Mr. Mokrahisi, the next time you're going to use county administration announcements for points of privilege, just let me know. I'm just being silly. Commissioner business. We are now embarking on what we hope is not an extension of 2020, although the next couple of days on the national scene is going to be so chaotic and so divisive that this board is wonderful in that we are going to attempt to be just the opposite. But are there any other commissioners that would like to share any business on their minds at this time? Commissioner Farr.
Thank you, Chair Bernie. Chair Bernie and board, I love to catch people doing things right. And I'm going to report on something that people did right over the extensive break that we just took. We have the shelter feasibility study that we work on, and Mr. Mokrahisi accurately pointed out that it used to be called the TAC report, and it really is technically the shelter feasibility study. It talked about our existing resources at the current time when the report was made, and how we had extensive resources, that the first line of attack on that report was to fully utilize and increase the capacity of existing resources without trying to, before we begin to add new resources. Now, in the meantime, we are adding new resources, obviously, River Avenue just being a single one of those facilities. But significantly, it pointed out that the mission was one of our existing resources that both was at the front line and one of the top single facilities in the area, and that also could increase its capacity and reduce its vacancy rate. And that would be one of our front lines of addressing the homelessness situation and the shelter situation that we all know about in Lane County. Over the holiday, over the break, a COVID outbreak occurred at the mission. It was well documented, and there's a great deal of fear and consternation that occurred with that. How is this going to affect the entire shelter picture in Lane County if one of our main facilities was suffering an outbreak of the pandemic? Well, what happened was Steve Adams, Greg Rickoff, and the rest of Lane County's public health staff stepped immediately to the plate, went down to the mission where Cheryl Balthrop was actually staying at the mission at that point in time during the emergency. Lane County staff stepped in and immediately got testing in place, immediately got protective supplies in place, and really pinched the potential outbreak in the bud. Lane County staff, I personally, from a distance, caught them doing something very well, Mr. Mokrice, and I would like you to pass that along, that it did not go without recognition across the board. Lane County stepped up to the plate in what could have been a really troubling situation and made it far less troubling. So, Chair Bernie, that's all I had to say at this point in time. Ms. Mokrice, thank you to your staff and to Mr. Adams in particular.
Thank you, Commissioner. Commissioner Trieger, Commissioner Bozovich, are there any announcements from you or statements? Commissioner Trieger.
I will just be very brief and thank everyone on the staff who's been so welcoming and so helpful and supportive in getting me onboarded and set up. It's only just begun. I do have a very steep learning curve, I recognize, but I'm just so appreciative of how welcoming everybody's been. It's a very weird time to be stepping into public office with virtual meetings. I know we all really miss the relationship building that happens when we can enter a meeting room and have those sort of informal conversations and as meetings break up. And so I look forward to when we get back to that. But in the meantime, again, just want to express my appreciation to my colleagues here on the board with me, particularly to County Administrator Steve Mokrice, who was new to the organization when I was in my first year on Budget Committee. So we were new together at that time. And I'm just really grateful for all your help and support as I step into this new role, and appreciate your work, and to the staff, particularly in this last year and how challenging it was. I see you, I see your work, I appreciate it, and I'm just really proud to be part of this team. Thank you.
Commissioner Bozovich, or are we good? Okay, I would like to thank Commissioner Trieger, whom I think I was the only one that did not know well during the campaign. And Commissioner Trieger relentlessly reached out to me, reached out to others, did her homework like no one I've ever seen. I think there are going to be many issues where her knowledge is vaster than my own, even though I've been doing this for a couple of years. And I thank Commissioner Ware all the richer for having you be a part of this body. So thank you for running, and thank you for being here. With that, the only thing I would like to say, because I believe it's kind of the 500-pound elephant in the room that we're going to be dealing with as a body this entire year, and that is, undergirding our work this year is the reality that literally everyone is exhausted. And I'm not just talking us and our staffs, which we know are, but everybody in our communities are exhausted and sick and tired and frustrated with COVID-19 and how it's impacted our lives and how it's impacted our businesses and our sense of hope for the future and opportunities. And I really believe this is somehow going to be the year we turn this lemon into lemonade and somehow work our way out of it. And that can only occur together. It's real clear, and we'll see in the next couple of meetings, that Lane County government is going to do everything possible given resource realities, and it will never be enough. I've seen county staff, as Commissioner Farr referenced, working their hearts out. Not just the jobs, but their hearts out. And yet we know, even when we celebrate our victories this year, they will still pale in comparison to the need that's out there. So I'm not saying anything you all don't know, but I'm really recommitting to this whole notion that regardless of political stripes, we are all we've got. We are what our community has. And I hope you all will join me in just absolutely committing to working together and doing our best, and knowing we will also suffer the slings and arrows of outrageous fortune. But it is an absolute honor to be doing this, and thank you for your trust.
And by opposing in them.
I'm sorry?
I just confirmed the Hamlet quote.
Oh, okay. Is there any other, if there's no other commissioner business, future board assignment requests? Commissioner Bozovich.
Thank you. I'd just like to request that the agenda team schedule an exec session to discuss the new City of Eugene payroll tax and the cost that the county is incurring due to that tax. I think everybody got the email from Thursday saying that we're having to set up a special customization of our time cards. There is a prohibition in the state for one public agency taxing another. And I'd like to have some discussion of that with legal counsel as to our ability to be reimbursed for our additional costs and or our ability to be waived from that.
So Commissioner, you're not asking for an opinion or a decision as much as a work session to discuss that?
An executive session.
Yes.
With legal counsel.
I'm sorry.
But I can't ask for that by myself. I need three head nods.
Commissioner Farr. Yeah, I know. This is a head nod now. Okay, gotcha. I'll nod my head to talking about that.
Thank you.
Are there any other requests, board assignment requests? Hearing none, I believe this is the review of assignments moment. Mr. Mokrahysky.
Thank you, Chair Bernie. And so that's the one assignment that I have. We'll schedule an exec session to discuss the City of Eugene payroll tax and the cost to Lane County. And then if there are further requests from that, we can follow up on that. Didn't have anything else. I do have, if we're done with the review of assignments, I have one hot off the press item related to vaccinations.
Please.
So just as an example of how quickly things move, I think we just completed maybe 45 minutes, an hour ago, our update on COVID, and hot off the press, we have OHA, the Oregon Health Authority, vaccination guidance update that is hot off the press that all phase 1A groups, so phase 1A, right, we talked about phase 1 has 3 different categories. In the first one, 1A includes hospital, healthcare workers, long-term care facilities, and EMS, as well as potentially some in the education sector. All of those groups 1 through 4 are now eligible for vaccine, and the shots will be administered by existing vaccination recipients, including hospitals, EMS, Eugene Springfield Fire Agency, Lane County Public Health, so on and so forth. So I just wanted to provide that update to the board. If that's clear, that all the 1 through 4 groups, those 1 through 4 priority groups within the 1A category of hospital, healthcare, EMS, long-term care facilities, all of those folks are now eligible to be vaccinated. So we'll begin the process to make that happen, and we'll have another update for you next week.
Thank you very much. I'm reading executive session. Do we have an executive session today?
I do.
No.
Okay. Okay. In that event, is there any other business that any commissioner would like to bring in front of the board? In that case, I believe that this first meeting of 2021 is over, and that we will reconvene tomorrow at 8 a.m. on the link given for the budget kickoff with leadership team. Thank you all so much and have a pleasant rest of your day.